everyone, my name is Kristen and welcome to my channel. I'm currently done with my second semester. I am going to be posting a semester 2 vlog post coming up, so keep on the lookout for that video. And I really just wanted to focus on today just a fun video topic of how I organize my scrub pockets, like what's inside of my scrub pockets. I feel like as nursing students we have so many pockets and we really don't need to carry around on the clinical floor as much as we think we do. So this video is all about how you can stay organized while you're taking care of patients. So if you're interested, just go ahead and keep watching. Alright, so for the purpose of this video, I am just keeping my hair down, but normally I would put my hair up and I would normally wear a headband to keep all my little flyaways from just going all crazy. But I am just wearing my scrub jacket. Normally I do wear this in the hospital because it does get pretty cold in the hospital, but if I do have to take it off, I will. I just prefer not to just because the pockets on my scrub pocket are the biggest and can fit the most items. So I do like to keep most of the bulk of the items on top just because I feel like if I put things in my pant pockets, they do get weighed down a little bit and I just don't like that feeling. But I do put a few things in there as well, so don't you worry. So I am just going to work in these front pockets right here on my jacket and then remove my jacket and then kind of go through the rest of my pockets. So in this front left-hand pocket, I don't have much other than gloves. Now, gloves I may or may not keep in my pocket. It just depends on the hospital location I'm at. So for my mental health clinical, there was only one location where we had gloves. So I always just made sure to take a couple extras just in case I needed to do vitals, pass out breakfast, or anything else I was doing that day that required patient contact. Now, in my other clinical for med-surg, every hospital room actually did have gloves, so I didn't really need to keep an extra pair with me. But I do know there are some circumstances where you do need an extra pair of gloves. So always make sure you're putting on gloves whenever you are working with patients, especially with all that's going on right now. Okay, so in this right-hand side, I actually have two different pockets. So I have a smaller pocket in the back, bigger pocket in the front. Now, I am not a person that likes to carry my stethoscope around my neck. I realize that that is so heavy and it's so uncomfortable. Like, I don't know how some of the nursing students sit there all day with their stethoscope like this. And to me, that's just, it like weighs down my neck and I can't do that. So I actually do put this in my pocket. And I would just say, make sure that if you do get a stethoscope, get your name like engraved on it or put some kind of nameplate, because I've had multiple individuals ask me to use my stethoscope now and I don't want this walking off. So I definitely feel like this was a good investment because now I'm able to just know which stethoscope is mine, and if I see it lying around anywhere, I know which one's mine and I will hold on to this for dear life. So, but yeah, I do keep my stethoscope in this side pocket. If you do wear it around your neck, just know that it may be a little bit heavy. Okay, so right in front of that, I do have my foldable clipboard. Now this little piece of equipment is so handy, and honestly, I would suggest get this clipboard if you're able to. Now, when you open it up, the pages might be a little bit bent, but when you actually put them back in a binder, they do flatten out. So don't be shocked if they bend, because they will, because the clipboard obviously bends. But normally in my clipboard, I obviously do keep a substantial amount of paperwork. Not all this paperwork am I going to need for my next semester. I really just wanted to get a feel of what I needed to know for a head to toe assessment and what the unit will do hour by hour, just so I have a better understanding of how I should be taking care of my patient. So I do have a lot of paperwork in here and I'm just going to quickly go through it if you're interested. If not, you can just go ahead and skip ahead. So I do have multiple report sheets in here, and there's a reason why. I do have one that my school provides and it's just for 2 patients. So as you can see, it's not as easy to go ahead and write in all the information I need on this one. But because I am following around a nurse has anywhere from 4 to 6 patients. So I make sure to print out a few of these so I'm able to keep up with the rest of the nurse's patients in case I do have to round in their rooms. Now, as a nursing student, I am assigned 1 patient and I will hopefully be assigned more patients as time goes on. But I did print out just a single report sheet so that I could have just for the 1 patient that I was working on, just so I had enough space to be able to write out everything I needed so it wasn't crammed on the other report sheet that I showed you. I also do have a layout of a care plan right in here. Now don't worry, I'm going to be talking all about care plans soon, just really how you pick a NANDA for a patient, how you organize your care plan. So I will be going through this, but essentially I do like to start my care plans while I'm at clinical, just so I'm not at home trying to scramble to finish a care plan the night before it's due. So I do like to kind of use my downtime while I'm at clinical to start care planning for my patient. Whenever you're handing off to another nurse, you will be using SBAR in the hospital. So this just means like what's going on with the patient, like the situation, the background, the assessment, and what are your recommendations. So I just make sure that I keep my SBAR printed out just because it is a good kind of layout of what I need to be telling the nurses. So I make sure that I just keep this underneath, and whenever I'm going through, I can just quickly kind of go through all the information to make sure I've hit every point. Everything else that I have in this clipboard is specific to the hospital that I was at, but essentially I just have what I should be charting on every hour for the patient, every 2 hours, every 4 hours, what I need to be doing once a shift. Then I have like the lab values that are approved by my school, just because you really do need to make sure that you're looking at lab values to see if anything is abnormal. And then it kind of just goes through the standards of the care for the hospital, and then essentially like their rules and regulations on like medications and all that good stuff. And then I do have a few pages in the back on a full head-to-toe assessment. Now, like I said, because I am comfortable now with the head-to-toe assessment, I probably won't be bringing the head-to-toe assessment paperwork with me, but I really did like having it, especially for the first few clinical days in med-surg, just because you're new and you're still learning and you really, kind of need that help to look back on. So if you're able to kind of put your own little head-to-toe assessment together, I would say do that, just because I did that for myself, and I even made like a whole script. So that was very helpful, so I knew exactly what I was looking for, and I felt confident going in, talking to a patient, and going through a full head-to-toe assessment. And that is all that I have in my clipboard. And that is all that I actually keep in my jacket. So I'm just moving on to my pockets in the front of my scrub top. Now I do have my badge clipped right on this little like loop that I have on my scrub top. Now I know some hospitals do require you to have your badge up top. Like I know the hospital that I previously worked at required us to have it up top at all times so they could see your identification. But if I can get it clipped down below, I do like to have this area free, especially when I'm working with patients. So I can't always say that you can get away with this, but for now I'm trying my best. Now I do just have my badge reel, which I've talked about in previous videos, and then I do have this clear protector on top of my badge. I don't have my badge in here for the purpose of this video, but these clear protectors were such a great purchase just because now with all that's going on, it's so easy to wipe down. So I really just want to say if you're able to go on Amazon and get some of these clear protectors, they work wonders. Now I do just have a few items clipped on the back of my badge. Now I do just keep one highlighter and one Sharpie with me. Now I've used my Sharpie almost every day at clinicals, and honestly, like other than these few items and then my multicolored pen and then one felt black tip pen that I have, I don't really use anything else like when it comes to writing. So it's so nice that I have all my writing utensils on here and I can keep everything else free of clutter. Like I said, whenever you're working with patients, it's gonna get so overwhelming and so heavy if you just keep sticking things in your pockets. So try to keep it as light as you can and try to be very practical about what you need, because you really don't need to be keeping everything in your scrub pockets. I do have tons of these colors for my Sharpies and my highlighters, so currently I'm just using the purple and the black, but I probably will be rotating throughout the different colors that I have just to make it more fun and festive. The last thing that I actually have clipped on here, which you may need to know for your mental health clinical, so I'll quickly just say it. Now, in my mental health clinical, we were not allowed to use a badge reel. We actually had to have just a badge clip. And that is just because a badge reel can be used as a weapon and a patient could tie it around your neck, just like long hair. So if you have long hair like me, somebody can take your hair and wrap it around your neck. I've heard it happened before. Lots of stories I have to tell you about mental health clinical. So be prepared, but just make sure that if you do have mental health or if you don't like the idea of a badge reel, get yourself a clip. This is honestly one of the safest options you can get. I always just clip this on here so I don't lose it for my mental health clinical. We're making our way through. Now in this front left pocket, I do just keep my cell phone. Now let me tell you, you want to protect your cell phone at all costs. I've literally had patients ask me to use my cell phone. I used to keep it in my pant pocket on the right hand side. Now I keep it right here close to me because I don't want anyone touching my cell phone. One, your cell phone has so many germs on it already, And then 2, I don't want somebody getting my identification, getting my name, finding my details, finding my social media, just because you really don't know who a patient really is. Although they can be super sweet, you really do have to protect your own identity, and you don't want somebody walking off with your cell phone. And like me, I have a wallet phone case, so all my cards and my ID are actually behind my phone. So this is literally my lifeline. So I just want to make sure that I keep my phone protected at all costs. So I do keep this very close to my body. Now in this right hand pocket, once again, I do have a back pocket and a front pocket. I usually just keep my scrub pocket organizer. I love this thing. Literally best $10 purchase I've ever made. Everything just stays so nice and organized, and literally everything has a home. So if you're like me and you like to stay super organized, definitely invest in this. Seriously, it was one of the best purchases I've ever made. And I'm not gonna go through all the items just because I have gone through all my lab items before and all my clinical items. So I really just quickly wanna say I do just have a black pair of bandage scissors, pen light. I do have an expo marker with me. This is so important. You're constantly going to be writing on your patient's dry erase board, telling them like when you're going to be coming back in the room. This is literally like the dry erase board is the communication between you and the patient, and not just you and the patient, but also the physician and the patient and any other health professional that's going to be going into the room. Just make sure you keep an expo marker with you because sometimes you may not find them. And I would definitely suggest, if you're able to, keep extras with you in your clinical bag just in case somebody else needs some, or you happen to lose yours, or yours runs out of ink. These are so important to keep with you, so do not forget your expo markers. Now I do just have in here also a black Papermate felt tip pen. Now I really do like the way that these pens write. I have so many different colors, so I make sure to just keep one with me just in case I lose my pen. I mean, I don't know if that pen would ever fall off the keychain, but I do make sure just to keep an extra black pen with me. And I do have a pencil and then I guess another black pen. I thought I only had one extra, but I have 2 extras, I guess. Then behind here, I do just keep a small memo pad with me. As you can see, I keep my clipboard. I don't have any extra paperwork other than the few papers that I write on. So I do just keep this with me in case I need to write anything down that's important, or something that I could use for like my notes later on. I haven't utilized these too much just because I do write all my patient information down on my clipboard in the report sheets that I have, but I would suggest just to keep extra paper with you just in case you might need it. And I almost forgot, I do have alcohol pads in this front pocket right here. You're gonna be utilizing these so often. I literally have to wipe down my stethoscope before I use it on a patient. If I'm giving an injection, I have to wipe down the patient to make sure that everything's sterile whenever I'm injecting the needle. So you are going to be utilizing these alcohol wipes a lot, so just take a handful whenever you go to clinicals and just keep them with you at all times. Okay, so the last few items are the items that I have in my pant pockets, and I do just have a roll of like bandage tape. Now, I did learn how to wrap somebody's IV when they do need to go, like for example, take a shower or like wash their hands. You don't want to get that IV site wet. So they have extra tape that you can use, and then you just have to get like some sort of bag. Like at my hospital, we were using specimen bags that we kind of just wrapped around their arms and then we taped it around. So I do like to just keep an extra roll of tape just in case I need it, so I don't have to run back and forth between the utility closet to the patient's room. Now in the left-hand side with the tape, I also keep some swab caps. Now these are just orange caps that go at the very ends of the IV lines. Sometimes you'll have 3 or 4 like openings that you can use to inject medication in the IVs or whatever you're injecting inside the line, and you want to make sure you keep those areas sterile just because they are an entryway leading into the patient that could cause an infection. So these are just antibiotic caps that go right on the end, and they essentially will just keep everything sterile. So a lot of the times I have seen in the hospitals that nurses do forget to put these on. Make sure that you remember to keep these on because we want to make sure we're limiting infection in the hospital, and I feel like this is such an easy way to limit and reduce the chance of a patient getting an infection just by sticking a cap on whenever you're putting in an IV. So don't forget your swab caps. And the last item that I actually keep in this left-hand side, I don't have with me just because I don't have any. I do get them when I'm at the hospital, but I will insert a picture right here, and that is a saline flush. Now, whenever you're giving medications through the IV, you will have to flush with saline, and that's just putting in like saline inside the IV line right before you give the medication, and usually you do that like before or after. But they are kind of big, so I do like to keep them in this left-hand side just so they're out of the way. A lot of the times you will be giving saline flushes like crazy, so I do make sure I do like to stock up and keep a couple with me, just so, like I said, I don't have to keep walking back and forth to the utility closet. So honestly, a lot of this too is just learning how to really manage your time so you're not constantly walking back and forth and tiring yourself out. So definitely get organized and try to get into a groove that works best for you. And in this right-hand side, I do just have tissues. Now in med-surg, I wouldn't bring these with me. I mainly just brought these with me for mental health. You never know whenever somebody was gonna cry. It was always really good to have tissues. Now med-surg, we had tissues in every single patient's room. So honestly, this would just depend on the clinical you were going to. But just so you know, you may need tissues. And the last item that I have in here, once again, depends on the hospital, and that is hand sanitizer. Now, mental health, we didn't really have an area where we could go get hand sanitizer, so I did just bring my own. I know that they did have it like in the nurses area, but it was always so hectic back there in the morning, so I like to just bring my own. But at med-surg, they had hand washing stations everywhere, and I'm hoping this stays consistent with my OB, peds, and community health rotations, just because I really don't want to have to carry around hand sanitizer. But you never know, sometimes the hospitals may run out, or they just may not have any on the floor where you're at. So I guess stay prepared and bring some with you. Well, that is actually all that I keep with me whenever I'm on the clinical floor. I do like to stay nice and light and not weighed down by all my nursing gear. So hopefully you can get into a groove and figure out what works best for you. I really hope you like this video because I know it is a little bit different than what you normally would see here on YouTube. So if you like the video, please give it a thumbs up. Don't forget to subscribe. And of course, I always want to be wishing you luck on your nursing journey.